Thank you for having me here today, Rosemary. It's a pleasure. So I'm the founder and CEO of B1OS. B1OS was started on the back of a personal challenge I had in my own family. I took care of my mother for 10 years. She was very bad type 1 diabetic. And during that time, it was very difficult to be able to take care of her, watch over her from not only a medical perspective, but to keep all of the records and information intact, right? And to be able to present that to the plethora of doctors she had, whether they were surgeons, her doctors, to keep her wellness doctors, or her dialysis doctors. And she did quite a bit of in and out of hospitals for a very long time. So I knew at one point in time, I wanted to do something about this, and the time has come. So we've built an incredible team and an incredible product called B1OS Health Pass. And what we're looking to do is start in emerging countries, and we're the first global digital health information system that's going to be out there. And I'll tell you a bit more as we go through it. So we've got a critical mission, and that's to empower and equip everybody in the world with comprehensive view to all, access and view to all of their health information, no matter where they are and anytime. The power of one is very strong inside of B1OS. B1OS is signified with a 1 for the I, which means we have one life. We should have one source where all of our health information comes from, and not only from an information perspective, but also from an educational perspective. So our value is really around creating that environment where it's at your fingertips, literally through biometrics. We'll talk about that in a moment, shareable with anyone that you deem trusted in your network. And we have an incredible vision of creating this inclusive ecosystem that's truly on a global scale, and utilizing blockchain to democratize healthcare information. The problems are persistent no matter where you go in the world. I've been in over 50 plus countries around the globe. I've worked in, and I've lived in 7. And one of the biggest challenges we see is all around redundancy and siloed systems, very restrictive access and limited visibility. It's time, I think, that you get to decide what happens with your data, and also that you get to monetize it. And so we're working on that. So we've completed a unique value stack called the B1OS Health Pass, right? And so what we've done is we created a stack that allows you to have a personal digital data vault, right? We do that through blockchain capabilities. So the data is tokenized, and we have a biometric patents that we use that allows you to be able to be identified and authenticated through your biometrics. We have also included IoT and telehealth, which is integrated, and we do that on the back of Zoom for our telehealth capabilities. And we integrate quite a few health devices out there, whether it's wearables or medical IoT, in order to deliver a dashboard for all of your vitals. We do that in allowing real-time access and sharing. We are HIPAA compliant, and we are building an AI engine on the back to truly deliver a personal health experience for each one of our individual members. We're delivering value through innovation. We do that in delivering a B2B model to these 4 verticals that we're starting with. So academia, insurance, life insurance, health insurance, business, and government. Each one we have a very significant value proposition for. I'm not going to bleed the slide, but it is all around digital transformation. In academia, a lot of the paperwork is regarding medical records and immunizations are still managed by paper and fax machines, believe it or not, whether you're in the States, in the Western world, or whether you're in the emerging countries. Life insurance companies love us. They are very much excited about driving behavioral health care, health insurance through this model. We've got some very large businesses that are looking at us, and we are working with some emerging governments in India and across Latin America and Africa to get started there as well, to bring this to some of the underprivileged communities, and as well as refugee camps. So while others compete, we complete. We truly play that data aggregator space. There have been a lot of gravestones in this space. A lot of companies have tried to do this in the past, where they look at other existing systems out there today and bring that data into a central repository. We believe that we have finally managed to do this in a successful model, and we're looking forward to bringing that out to the rest of the world. So a lot of people say, Mary, why B1OS? Why now? The need has always been there. A lot of John Hopkins did a research not long ago that said over 250,000 people die in early death in the United States alone because doctors do not have the correct medical access and medical information around a patient, especially when time counts. And so the need for that is great. It always has been. The market, we are very health aware, I think, coming off the coattails of COVID. I've done thousands of interviews around the world, both medical professionals and non-medical professionals. And it is time. People have realized that they don't know enough, they don't have enough awareness, and there's just too much data out there that that people don't know how to reach. And it's not, by the way, specific to their particular health needs. The third part is the tech, right? So we do have patented biometric technology. Biometrics has come a really long way. We actually check the entire hand, so a lot of 150 data points that we check, but we can also integrate in other retinal and fingerprint models as well. We are using blockchain to secure the data on the back end, and of course, cloud computing has changed the world in a lot of different ways. I'm going to pause this video. I won't play that now. We can add it on later in the present or in the LinkedIn profile. But where we are today, we're getting ready to launch. We are pre-revenue, so we've got a $5 million pipeline. We are launching in Q2. We are starting in India, so we've got a group that 37 universities, 1 hospital, and 2 clinics. We've also working with the government of Tamil Nadu with 50 medical clinics there. And we've got 1 US contract that we've signed with a group in New Jersey, as well as we're working with Fordham University on a research program around value-based healthcare. So our go-to-market plan, we are focusing on India. Our goal is to get 3 beta customers, each of 22,500. We actually, I have to apologize, that slide is, I didn't update that slide. We actually have 375,000 customers that are on the list to be set up by the end of this year. Expansion in each vertical, we've got, we want to acquire 12 clients past this year with an additional 80,000 members. We do plan to expand in additional geographic markets. We have an opportunity in South America as well as Africa, and from there we will look to deploy in MENA, Europe, and the Americas. So we have a B2B SaaS model. We're launching, and as I mentioned, our production environment is going to launch in Q1, but we're going to sign on our first customers in Q2 and then Q3. We're looking at a total of 3,775,000 by the time of 2026. That's, of course, we've got a $5 billion pipeline right now that is that we're looking to work on, and we are looking to get that signed in the next 3 months. Our investment opportunity, BIOS is offering an early intro. We've got a $2 million equity round at $10 million pre-money with a conversion discount of 20%. That gives us an 18-month runway to Series A. We've got an incredible team. This team is each one of us have over 2.5 decades in the in our each individual expertise. Many of us have started companies before. Some have been in corporate. I won't leave the slide, but they are an incredible team that have an eye on social impact and doing better for the world. And really looking forward to continuing to prepare ourselves to get going here. I think my time is up. We'll wrap up with the fact that I hope you guys join us. We are truly reimagining health equity for all. My information is there if you'd like to reach out to me.